Okay, so the next thing that we want to talk about is we want to talk about hemostasis. So hemostasis is trying to stop bleeding, okay? So it's the cessation of bleeding. So we're trying to stop you from bleeding. So I have written stopping potentially fatal leaks, and a hemorrhage is when you have excessive bleeding. So it could make you anemic, it could drop your blood pressure, it could kill you. Okay, now, there's 3 things that are going to happen to stop bleeding. Okay, so the first one is vascular spasm. Okay, so vascular spasm you can think of as you're squeezing something. Okay, so you're squeezing it. The second thing is we plug it. So what happens is we form a platelet plug behind it. And then the third thing, which is probably the most complex, is blood clotting, or which is also known as coagulation. Okay, so coagulation and blood clotting are the same thing. So basically 3 steps: squeeze, plug, clot. Okay, so I used to say squeeze it, plug it, clot it. Okay, so platelets are going to be really important in all 3 of these. So let's look at this picture. Okay, so here you get cut. Okay, so say you cut yourself with a knife, you're making dinner. So the first thing that happens is when the tissue is injured, the blood vessel is going to constrict. Okay, so vascular spasm. So you're going to try to squeeze it and stop the blood from leaving it, which is kind of cool to think about. The smooth muscle automatically does that. Okay, then the next thing that'll happen is because the wall of the vessel is damaged, the platelets are going to come, and platelets are just kind of like misshapen pieces of cell, and they'll stick and they'll start plugging up the hole. Okay, so they form what's called a platelet plug. Okay, and then what will happen is we'll actually clot it. Okay, so that the clot will fill it in and stop the blood from leaking out, and then mitosis will occur. Okay, and the hole will be repaired. Okay, so we're going to talk about all those steps in a little more detail. Okay, so platelets. Platelets are made out of this megacell, out of this big cell. So this big cell is called a megakaryocyte. And platelets are, it's getting rid of my symbols. That should be micrometers. Okay, so they're little. They're itty bitty tiny. Okay, so they're little. They contain granules. They have amoeboid movement, so they kind of like ooze around, and phagocytosis can occur. Okay, so normally we have between, and this is like a super huge range, right? 130,000 to 400,000 platelets per, and that's wrong, right? Microliter. Okay, now what the platelets do is they're going to secrete vasoconstrictors. Okay, so that's the squeeze it. They're going to stick together to form a platelet plug to kind of seal a hole. They're going to secrete chemicals, so proteins, procoagulants, and clotting factors that are going to make clotting occur. They initiate formation of clot dissolving enzyme. Okay, so you got to, once you have a clot and your tissue heals, you need to get rid of the clot. So we do that with this clot dissolving enzyme. Okay, platelets release chemicals that attract neutrophils and monocytes to where the damage is. They can phagocytize and destroy bacteria, and then they're going to secrete chemicals that start mitosis. So they do a lot, okay, for these little tiny pieces of cell. Okay, so platelet production is called thrombopoiesis. Okay, maybe you've heard of a thrombus. Okay, so a thrombus is a blood clot where you don't want it. So it's somewhere it's not supposed to be. Okay, now the stem cells. Okay, so we still have the pluripotent stem cell, or the the pluripotent stem cell. Okay, they are going to develop receptors for the hormone that makes platelets, which is called thrombopoietin, and they become what's called a megakaryoblast. Okay, so it's this big, huge cell. So here's, kind of looks like this. Okay, so there's one. That's a megakaryocyte. That's after it's mature. Okay, so megakaryobasts, what they do is kind of cool. So they replicate DNA without dividing. So they end up with like a whole bunch of nuclei inside of them. So if you look in here, there's just like a whole bunch of them. Okay, so they form a gigantic cell called a megakaryocyte with a multi-lobed nucleus. And should be millimeter or micrometers in diameter. So they stay in your bone marrow. Okay, so here's bone. Okay, there's some red bone marrow. Here's a picture of a real one. Okay, and then here's the cartoon of it. Okay, so that's a megakaryocyte. So it stays in the bone marrow. It can't leave the bone marrow. But what happens is pieces of it kind of go into the blood vessel. Okay, so see how these little limbs are going into the blood vessel? And then as the blood flows through, they break off and they form these little cell fragments, which are platelets. Okay, so here's how the book describes it. Okay, so they live in the bone marrow adjacent to the blood sinusoids. Okay, the tendrils, okay, so these little fingers of cytoplasm protrude into the blood sinusoids, and then the blood flow breaks off the fragments, and the fragments are what is actually the platelet. Platelets circulate for about 10 days, okay, and 40% of them are stored in your spleen. So your spleen's like a little reservoir for things like this. But cell fragments, they're cell fragments. Okay, now, here we go. We go back up here. So the vascular spasm, what causes it? Where does it come from? Okay, so the vascular spasm is when the blood vessel constricts. Okay, and the idea is the blood, so you don't keep bleeding. Okay, now what causes it to occur is when you're cut, the pain receptors are stimulated, and they actually innervate the blood vessel and the smooth muscle, and it will constrict. When the smooth muscle is injured, it'll constrict. And the platelets actually will release serotonin, and serotonin is a vasoconstrictor. So the idea is we're going to constrict it. It's going to give us some time to actually form a clot, and it stimulates the pain receptor, so you know you did it. You know, oh, I need to go put some peroxide and a Band-Aid on it. Smooth muscle injury will hurt longer, okay? And hopefully that spasms a little bit longer. Okay, now, platelet plug formation. So normally, inside a blood vessel, the endothelium is really, really smooth. Okay, so in here, I should have got a different color. In here, okay, normally that's like super smooth. Okay, so I always say it's like if you have a Teflon pan or a nonstick pan, it's coated with this chemical, okay, and the chemical is actually called prostacyclin. And prostacyclin is like a platelet repellent. Okay, so it keeps the platelets that are floating around out here from accidentally sticking on the blood vessel. Okay, so we don't want them to stick someplace where they're not supposed to, because we don't want to clot someplace where it shouldn't be, because that's a problem, right? So the prostacyclin, this red, okay, so we could say that the red is prostacyclin. The prostacyclin is what's making it smooth. Okay, now if it gets damaged, okay, so let's say we get cut. If it gets damaged, then the platelets will actually stick where the Teflon or where the prostacyclin is damaged. Okay, so broken vessel exposes collagen. Okay, so collagen is the protein in there. The platelet pseudopods. Okay, so platelets kind of look like this. can look like this. And so these little, a pod is foot. Okay, a pseudopod is a false foot. Okay, so these little pseudopods actually stick, so they can stick to the opening, and then they can move, they can constrict. When they constrict, they'll pull the holes together. Okay, then the platelets will start degranulating, and they'll release serotonin. They're going to attract more platelets, and they're going to keep, that whole thing is going to keep happening over and over. So they're going to attract more platelets, and they're going to keep constricting. And gradually what will happen is we'll get, the vessel should be sealed. Okay, and you get like it's called a platelet plug. So it's like you're plugging it up with platelets. I hope that makes sense too. I keep saying that. Okay, now, third step, okay, is coagulation. So coagulation or clotting is the best way to stop bleeding. Okay, so essentially, in a nutshell, what we're going to do is we're going to convert fibrinogen, okay, which is a protein, into fibrin. Okay, and that forms the network of the clot. Okay, so if you look at this picture, here are a bunch of platelets, okay, and then all of these little stringy things, that's actually fibrin. And the fibrin is, it forms this like a net, and then the blood cells stick in it. And then what happens is the cells start going through mitosis, the damaged tissue goes through mitosis, and hopefully it fixes itself. Okay, so fibrin is really, really important. You can even think about if you've ever think of a blood clot, and this might be gross, but I'm giving you a heads up. Like think about maybe a bloody nose or something. If you've ever had a bunch of blood, if somebody has a really bad bloody nose and then like it seems like it stopped and then they sneeze and a clot comes out. Okay, if you kind of pull that clot out, you can see the fibers in there, and that's fibrin. That's what's holding it all together. Okay, now we're going to talk about clotting factors. So clotting factors are normally produced by the liver, and sometimes they call them procoagulants. Okay, so pro is before. So basically what happens is we're going to have this big biochemical reaction, which is a cascade, and it's going to end when we get the blood clot. Okay, now there's two different ways we can get to it. We could get to it via this extrinsic factor, or we could get to it by intrinsic. Okay, so extrinsic's from the outside, and intrinsic's from the inside. Okay, so extrinsic means if you cut the tissue from the outside, and then intrinsic means like if something gets damaged inside. Okay, now this picture is showing you two different ways to get there. Okay, so intrinsic is inside, extrinsic is outside. So let's go outside first. So let's say you damaged some tissue. Okay, what's going to happen is you're going to have factor 7, factor 3, and you're going to have calcium. Okay, and they're going to lead us to this common pathway. Okay, now I want you to know that intrinsic exists, extrinsic exists. I want you to know this bottom part down here, but I'm not as worried about you memorizing all the, actually this one's easy. This is easy. This isn't too bad either. Okay, so you have to have calcium, okay, on both pathways. You need factor 7 is extrinsic, factor 3 is extrinsic. Okay, now, intrinsically, okay, you have factor 12, okay, and that's going to activate factor 11, which activates and gives you factor 9, okay, and then factor 8. Okay, now, if one of these is missing, it messes up the whole thing. Okay, so if someone doesn't have factor 8, okay, then they can't clot this way. Okay, so all of these steps are really important, although I don't know that I'm going to make you memorize them all. Okay, I'm more focused on this common pathway at the end. Okay, now what's going to happen here is factor 10 is going to be activated, and it gives us this thing called prothrombin activator. Okay, prothrombin activator can take prothrombin and it makes thrombin. Okay, thrombin is key because it's going to activate fibrinogen, and when it activates fibrinogen, that gives us fibrin. Okay, and the fibrin's what's going to make the clot stick together. There's just a whole bunch of steps, and at one point in time I made my students all memorize it, and then I was talking to a hematologist and he didn't have it perfectly, in his head, and I'm like, wait a minute, this is what you do for a living and you don't have it memorized. I guess you guys don't have to totally memorize it, but this bottom part is important. Okay, so 10, prothrombin. Okay, prothrombin activator activates prothrombin to thrombin, and thrombin is key to activating fibrinogen to fibrin, and that's where the clot occurs. Okay, now, you can't have a clot just stay there forever. So basically what should happen is the clot should start to retract and kind of shrink up within 30 minutes. So what will happen is the platelets that are around there are going to start releasing growth factor, and then the cells that are there are going to start releasing growth factor, and they're going to cause mitosis to occur so that the tissue repairs itself. Now what should happen is the clot should break down. Okay, and they call it fibrinolysis. So if you look at that, that makes sense, right? Fibrin, that's the fiber of the clot, and lysis, so we're lysing it, we're breaking it apart. And the enzyme that breaks it apart is called plasmin. Okay, so normally in our body, we're in homeostasis or equilibrium between plasmin and fibrin. So we're equal. Okay, now, clotting disorders. Okay, so clotting could go one of two ways, right? You could have too many clots, or you could have no clots, or little clots. So the first one I have is hemophilia. So hemophilia is deficiency of any clotting factor. Okay, and they categorize it based on what factor is missing. It's usually genetic. Okay, so it's hereditary diseases. You're deficient in one factor or another. And sometimes people are really unlucky and they get more than one. Okay, the main kinds of hemophilia are sex-linked. Okay, so they're on the X chromosome. That's what that means. So they're going to be located, like a female is XY, or a female is XX, and a male is XY. So the hemophilia trait is on the X chromosome. So if a female has it, usually, right, she only has it, I'm going to change colors. Usually she only has it on one chromosome. So if she has sons, right, she's going to give it to them. Well, not necessarily, right? It's 50% that she could give it to them. So they either get her normal X or they get the X that's damaged. And if they get the X that's damaged, they don't have anything to counteract it over here. So they end up with a disorder. Where if she had a daughter, okay, so let's pretend she has daughters. So X, X. So this is the bad X from the mom, but if the dad gives the other X, then she's okay. Okay, so anyhow, it's sex-linked is what I'm trying to get you to see. Okay, so hemophilia A, they're missing factor 8. Okay, so this is more common. So 83% of the cases of hemophilia are factor 8. Okay, now hemophilia B is missing factor 9. So this is only like 15% of the cases. What's interesting is around here, this factor 9 deficiency is common in the Mennonite population. So they see more factor 9 problems than they do factor 8, even though that's not the normal distribution in the United States. Okay, now von Willebrand's, okay, it's actually autosomal, and women can end up with it too, but so do guys. Okay, most of the time when they talk about it, you don't have to memorize the A and B. They say they're factor 8 deficient or factor 9 deficient. Okay, now what happens is these people can spontaneously bleed. So sometimes, like if they're exercising, they can bleed into their joints, and that's not good. Okay, it used to be that they would do blood transfusions to get healthy clotting factors into people, but now they can be produced using biotechnology. So their factor 8 is produced with transgenic bacteria, so they never have to get a blood product. I think they're also doing gene therapy with this. Okay, now a hematoma. I have a hematoma on here. Come on. A hematoma is just when you have a big bruise, so a mass of clotted blood in tissue. So it's a big bruise. So people that have hemophilia lots of times have hematomas. Okay, now more common than hemophilia are people that clot too much. Okay, so blood clots are a major problem. So a thrombosis is abnormal clotting in an unbroken vessel. Okay, so they call a clot a thrombus. Okay, and if somebody's inactive, like you have surgery and you're on bed rest, okay, it's easy to get a deep vein thrombosis. So they try to give you a blood thinner or anti-clotting medication and try to maybe use the pump, the air pressure pants or things on your legs to keep the blood circulating. Okay, now the problem is if the clot breaks free, okay, then they call it an embolus. And an embolus could, if you had a pulmonary one, that's really bad. So that one goes to your lungs, and those are the ones that can kill you, is a pulmonary embolism. So you don't want to get a thrombus, and you don't want the thrombus to become an embolism.